Let's look first at clinical depression. This slide is hard numbers. These are not estimates. This is the increase in clinical depression we have actually seen in the United States because of COVID. Left column is the percentage of the U.S. population that had symptoms of these four categories of depression: severe, moderate, or mild depression. Pre-COVID, and then in the middle is during COVID, and so the right column is the difference between pre-COVID and during COVID. Our COVID response, if you sum up the top three categories, which is moderate to severe depression, which is considered major depression, our COVID response threw 19.3% of the U.S. population into major depression. That's not 19.3% we're at now 27.8%. It threw 19.3% of the U.S. population into major depression. 63 million people were thrown into major depression. 63 million. An additional 8.4%, representing 27 million people, were thrown into mild depression. And it's important to emphasize, these people didn't become depressed because of COVID. On the rare cases when you see a newspaper article or something that mentions there's an increase of depression or something like this from COVID, it says, oh, this is another terrible thing that happened because of COVID. It didn't happen because of COVID. It happened because of our response to COVID. If we just ignored COVID, if we'd just gone about our lives as before, we'd have had more people die from COVID, but we wouldn't have had any increase in clinical depression. The increase in clinical depression is because we isolated people from one another. We ordered them to stay at home for 2 months or so in most states. We've closed their churches and their restaurants and their bars and their workplaces so they can't socialize with anybody else, or are socializing less than with anybody else, than with other people. And that's obviously, we're a social species. Meeting and socializing with other people is the source of most joy in our life. And so when you take that away from people, obviously you're going to have more depression. So can we compare these numbers to the number of COVID deaths we're averting? We have thrown, by our COVID response, 63 million Americans into major depression. How does that compare to the COVID deaths we're averting? Is there a way we can compare that to the COVID deaths we're averting? Well, I think you can think of depression as a lost time of life. For the time you are depressed, you probably view your life as almost worthless. And if in fact you believe you're never going to come out of your depression, you're very likely to actually kill yourself and decide that you would rather be dead. One way to think about this is, would you rather have now, at whatever age you are now in your life, would you rather undergo major depression for a year, for 12 months, or die at the end of your life a year earlier than you otherwise are going to die? For me, that's a difficult choice. I think I'd actually probably rather die earlier. I mean, I've been depressed. Depression is awful. I presented this idea of period of depression equaling lost time of life to a friend of mine, and she said, no, it's actually worse than dying, because dying is oblivion, depression is pain. So it's actually worse than an equivalent earlier death. Be that as it may, I think it's at least comparable. So I think it's a fair comparison to consider the period of time you have major depression to consider that to be a lost time of life. So we can compare it to the person years of life we are saving by preventing COVID deaths. So I'm estimating that we are saving 200,000 lives by preventing 200,000 deaths from COVID with our policies. We know, this is a hard number, not an estimate, we know we've thrown 63 million people into major depression. So that works out to 316 people thrown into major depression per COVID death we've averted. The average episode of major depression is 20 weeks, which is 0.38 years. So you multiply the 0.38 years times 63 million people, it works out to 24 million person years of life lost. As I said, I'm estimating 800,000 person years of life gained by preventing COVID deaths by our policies. So using those two numbers, it works out that we are causing by our policies 30 times the loss of life from increased depression, increased major depression, compared to the period of life we are saving by preventing COVID deaths. 30 times. Look at this figure. I'm going to hold this figure up for a moment. I think at this point the debate should be over. The debate of whether our COVID response was worth it, whether the benefits exceeded the harms, that debate should be over when you look at this slide and this data. Of course it wasn't worth it. Of course it wasn't worth it. The only way you could possibly say that it was worth it is to completely discount depression. Just say that depression doesn't count. I don't care about depression. I don't care about happiness. I don't care about joy. The only thing that matters is how long people live, how long people live. Duration of life is the only thing that matters, not quality of life. If that's your attitude, then yes, our response has been worth it, perhaps. If you consider quality of life to be important also, then no, clearly it has not been worth it. Clearly we would have been better off to have done nothing and just let COVID take its course.